I think we're gonna start, guys. Hello, everyone. This is Hemi Gupta, Managing Director of My Whole Child Center for Kids with Special Needs from GK2 New Delhi, and I'm also a founder of My Whole Child Trust. My Whole Child will takes care of various disabilities like autism, ADHD, cerebral palsy, Down syndrome, dyslexia, and many more. We believe in holistic approach, which means we look at the child's physical, emotional, developmental, behavioral, social, and learning needs of a child as a whole child. During these difficult times, we have also started helping families with teletherapy, which is very exciting and doable, as it allows us to help families from India, all parts of India, and various parts of the world. Today, we're launching our 6 session series, The Journey of a Child. Did we get it right? The idea behind this series is to spread knowledge and awareness of various stages of our child's upbringing. This series is taken up by Dr. Naveen Mehrota, who is a medical director of My Whole Child, a pediatrician from New Jersey, and also a co founder of My Whole Child Trust. I can talk a lot about him and his accomplishments over the last 28 years, but I would like to thank him personally on taking his time and energy on educating in India on childcare. Um, our first session today will be about our journey at the time of conception and pregnancy care. To get the valuable insight to this, we are very lucky to have a very special guest with us, Dr. Meghal Patel, a specialist in women health and pregnancy care from Harmony OBGYN, serving the community of Central New Jersey. He routinely cares for his high-risk pregnancy and will share his perspective on prenatal care. At this time, I would like to hand over to Doc and Dr. Patel to help us understand the process of prenatal care.
Thank you so much, Hemi, for helping us organize this. Thank you, Ashana, and thank you, Ketan Schools, for helping us bring this together. And I really want to thank my dear friend and colleague, Dr. Meghal Patel, for at the last minute trying to join in. I know he's very busy with being in the hospital and waiting for those babies to come out. So thank you so much for taking that time to be with us today. I think they say the world goes round by kids, right? We are the center of this universe. This is how procreation and then how society keeps on going. But when somebody gets pregnant, I know there's steps to it, right? They're trying to get pregnant, and finally they get pregnant, and then at that point, there's all these fears that parents have, and how do they go through the pregnancy care? Are they doing everything right? Is the kid going to come out totally normal? I mean, there's a lot of thought processes. So Meghal, please go ahead and enlighten us as to what is it that, once somebody gets pregnant, they come to you, how does that work, and what's the next step?
Well, first let me say thank you, Hemi and Dr. Mehrota. It's a pleasure to be on. It's a pleasure to be a part of this, attempt to educate the people about, prenatal care, pregnancy care, and beyond. As we start into a new pregnancy, sometimes it can be difficult. Obviously a very exciting time, but also, you can have some challenges. And our goal whenever we start in any pregnancy is to identify those potential situations very early on. And we do that with a lot of testing and the help of ultrasound, and we can discuss that further. But, it really is a holistic view, trying to balance, the pregnancy, but also the family dynamics, and how it can be with the experiences in past pregnancies and the goals in the pregnancy that's set. So.
Right. So thanks for bringing that holistic approach that needs to happen. I know there's always the fear that they've heard about kids that may have been born to their friends or neighbors that may have had special needs. They're worried about, is their pregnancy happening properly? What are some of the testings that they go through that you would go ahead and guide them on?
Yeah, that's a great question because, unfortunately, we get a lot of information. It's very common from the internet, from Dr. Google, and, friends and family, obviously out of love, share their experiences. And sometimes that can be a little bit scary because the bias is to all these stories that can come up, which may be a little bit more dramatic and not necessarily the normal experience. So a lot of times, as we enter into prenatal care and our first visits, either before pregnancy starts or at the start of a pregnancy, it's talking about normal and explaining that we shouldn't always expect the worst. Most pregnancies go very smoothly. There shouldn't be a sense of panic or fear at the start. Obviously, every situation is different, and people's experiences and their health issues can affect their chances for complications. But we use blood tests at the beginning of pregnancy. We use ultrasound to get views of the baby. And a common question I get about these tests are they safe? And the goal in taking care of a pregnancy is to be aware of the safety of mom and baby. So yeah, absolutely. Our goal is really to choose tests that are perfectly safe without taking any risk. There are oftentimes more invasive tests that sometimes doctors will need to recommend. We don't need to get into those, but those kind of advanced tests sometimes carry risk. But when we talk about ultrasound, there's no radiation, there's no harm to the baby, and it gives us an early view at the pregnancy. It doesn't tell you everything, and there's limits to science and what you can learn, but it's helpful for us as the medical team and families as we take care of them to have a sense that yes, of course, everything is going normally and as we hope and expect.
So I guess to encapsulate this, somebody's been trying to get pregnant. They may finally get pregnant. It could be through IVF. It could be through natural processes. And then once they get pregnant, they come to you. Then they go through a series of testing, which could include blood tests, which can look for some chromosomal abnormalities. They would look for ultrasounds, which see how the kid is growing well. But depending on which doctor they go to, there might be 10 different types of tests that are offered. How do you actually navigate this big system? You sort of blindfolded, just go ahead and follow and develop that trust and take that, or is there something else that the parent needs to think about when they are actually going through this whole process?
Fortunately, a lot of the early testing, as far as genetics and anatomical issues, are broken up into, as I kind of spoke about, the blood work and the ultrasound, and it's a very standard, set of tests because we have a lot of research and scientific data that shows the benefits of these tests. And when we talk about genetic testing, we're mostly talking about a combination of three major genetic problems, including Down syndrome, trisomy 13, trisomy 18, along with some other more rare genetic problems. But Down syndrome and these other major genetic problems are important to test for because they're more common when you compare it to other, genetic problems, which can obviously be there. The human, genome and DNA is a very complex, system, and so there are so many parts to that equation. But when we do our kind of standard testing, things that we should routinely do for everyone, it's a very organized and standard approach that when you go see a specialist for your pregnancy, you are, you really should be guided in the same way every time from the beginning. And small changes due to kind of the high risk nature, age, and other factors do come into play, but generally it's the same. So you don't really have to worry about, is one doctor treating me differently from another, generally.
So, I think the people who are joining in right now, we're talking about the journey of our child and why would a Center for Special Needs be addressing these topics. I think because there is a fear and, there are some things that may deviate from normalcy, which then can lead up to having a child with special needs in a small number of cases. And we think it's important for all in the community to understand how things start at the very beginning when you sow that seed and start to develop inside the mother's womb, and then we take it through adulthood. So so we do these testing, and if the testing comes back positive or if it comes back negative, how does a parent actually deal with that, and what should they do with it?
Yeah, the information that you get from genetic testing, everyone who hears that information handles it very differently, and that's why it's so important to have a relationship with your pregnancy care providers. Myself as an OBGYN, I routinely am discussing the tests that we go through with as far as these early genetic tests and ultrasound processes. And the point here is, if something does come abnormal, which we obviously are always looking for, but we're hoping to get a very normal result, but unfortunately tests do come back abnormal, and then we need to discuss kind of what does that mean. An abnormal test, I kind of touched on it a little bit, can be tested because once you have this screening test that comes back, it's a blood test, it's a combination of ultrasound, and once that shows there may be a problem, really the answer becomes, I want to know more specifically, is there something, or is this baby normal? And the best way to do that is with what's called invasive testing. And we're generally talking about what's called amniocentesis. And that test is where, through using ultrasound to guide us, very carefully putting a tiny needle into the bag of fluid around the baby where some of the skin cells are floating around, and we can draw back that fluid and send that for more precise DNA testing. And that helps us to really know once and for all, as close to 99% as far as the sensitivity of that test, to identify what is the DNA, what are we really dealing with. And it's important to mention here that genetic testing is important, and it helps us to know a lot about an early pregnancy, but it's not everything. And families who have a child with special needs, or hear about children who may not be following a normal developmental path, sometimes they wonder, okay, is this something we could have identified earlier? And oftentimes the genetics are normal. If your genetic testing is normal, it doesn't necessarily rule out the possibility that maybe later there may be other issues. So while genetic testing is powerful, it cannot tell you everything. And that's really important to realize as we, obviously want to know that everything is going to be normal and okay. There are limits.
So it's about just getting more information.
That's right.
One question, Dr. Mayo, we get a lot, and we see a lot in our practice too, is if the first child has gone through some kind of disability, it could be anything. The parents are, of course, very concerned, worried when they're planning their second baby. There's always that fear, always that worry. Does that have any relationship at this point, being an OBGYN and doing this? Is there any relationship with the first pregnancy or to the second?
I think that's a great question. And again, it comes back to that idea of genetics. And, there are, conditions that, families face, which are genetic. And, theoretically, you can have that come back in future pregnancies. But the conversation that I usually have with a family who have, their first child affected by something, often starts with, I had no idea that, this could happen, right? This feeling that, I thought everything was going to be fine and it wasn't. And then the light turns on. Parents really get the sense that I want to do everything I possibly can to make sure this doesn't happen again. And you can absolutely understand that feeling. Once you've gone through something that is so challenging, you don't want to go through that again. And that's a very reasonable thought process. The limitation is, again, because if it's not a genetic problem and we're talking really about really complex neurodevelopment and the early life of a child is follows a path that is not always seen in that DNA structure. So basically what I'm saying is our tests may not necessarily show any of those things for the future. And really it comes back to what I talked about very early on, was that it's important to realize that we're expecting normal. We really want to take that tension away, take the stress away, try to really focus on looking for things that may come up, but really planning for normal and really not having so much of that stress and anxiety and fear come into the picture, because our goal really is to guide to the end of a good, healthy pregnancy, not to expect that everything will be abnormal. Because again, with conversations with family and through reading the internet, it almost seems like everyone's facing really abnormal and complicated pregnancies. That's not the case.
Right. So I think very nicely said and very nicely put, because this is a common thought process that many parents have. And it doesn't necessarily have to be another child that's in the family that's quote unquote not the normal that they were expecting. It could be even from spontaneous mutations that can happen genetically, right? So Down syndrome and so on. So it could be your first kid, 1 in 800 kids can be born with that. So it's about making sure that you are educated about the whole pregnancy process, making sure that you have a good partner who can guide you to the right testing, and making sure that you're prepared for whatever comes. Is that what now, in case there is something that turns out positive, what would a parent do? Is that too broad a question there?
Well, I think it's as you mentioned, educating yourself, learning, planning, understanding. What are we facing? And people talk about they're at the start of their pregnancy. They say, "Well, I'm so happy to be pregnant. I don't even want to know if there's a problem." Right? This idea that why am I even doing any testing? That doesn't matter. I'm gonna love my child no matter what. And I understand that. I understand that thought, and sometimes that's appropriate. But here's my side of it. Information guides us. Information allows us to be prepared for what's out ahead. And I always like to think of, a dark room. When you walk into a dark room, you have no idea kind of what's in there, and that can be scary. But you flip on the lights, you bring that knowledge, you bring that understanding into the picture, and now the fear goes away, and you can plan your next steps way more efficiently. And so, the idea here is that information is very powerful, and that's where understanding and planning and education comes into play. And that's really, a big part of why we're here today.
Right. I know, I think people may have questions, and the time has been flying through. So what is the process that they can just send us questions and we'll try to get back to them later on?
They can just send us questions. You can go on our Facebook sites. You can ask questions. We'll reply. We'll get back to you guys.
Okay. So now if you do, just to sort of, I know we have very few minutes left, getting towards if there is an abnormal or if there's something that's deviating from the normal, what actually may happen at the time of delivery, or what should the parents think about at that point, at the birthing process?
Yeah, I think it's important to mention that while, when you have something that is abnormal in a pregnancy, obviously the team is going to guide you and help you know about, where, how, and when the delivery should take place, and that's our role. So sometimes we'll plan that delivery in a specialized center that can handle things like heart surgery. Sometimes it's about having specialists be prepared ahead of time to repair cleft lip, cleft palate, a club foot, structural things that need surgery. And other times it's really about preparing our new parents for the the time after when the child is born, and being prepared for what the special needs of that child will be. So it's a whole spectrum. But again, I want to come back to the point where oftentimes we're not finding anything abnormal. It's a very smooth and normal pregnancy. And I think our future sessions may address this. The pregnancy goes very smoothly. Everything looks very good. And then later on, we find other issues, which may not have really much to do with the pregnancy, but oftentimes our mind goes back to, what happened? What went wrong? What did I do to cause this problem? And I really want to make it very clear to our listening kind of family and people who are thinking about pregnancy, people who have had a pregnancy, that really it's not something that you've done wrong to, that causes these problems. So many of these things are really out of your hands, and it's really our goal is to make the best of every situation, try to guide ourselves with knowledge to the best possible outcome that we can have. So the planning is really the key.
Along those lines, just a very quick last question. I know we're short of time. Can parents take any sort of supplements any sort of natural products, herbal products that can make sure that things go smoothly in pregnancy?
Yeah, there is a lot of evidence that folic acid helps to prevent spinal cord abnormalities. Prenatal vitamins, which include DHA, generally 200 milligrams, is a great supplement to help with brain development. And I encourage anyone who's thinking about a pregnancy to make sure you're taking your prenatal vitamin. Other supplements which are marketed through the internet and through other various sources generally are not proven, and so you want to be careful taking things that people say help prevent problems, because generally those are not proven.
Yeah, we're running out of time, but anyone who has any questions, please feel free to ask us on our Facebook site. Send us queries, and we will get back to you guys at no time. We have to wrap up. We have a last 2 minutes left. So the last thoughts I would love to get from you guys.
Well, it's an honor to speak to y'all, and I look forward to opportunities to again talk about pregnancy care and the early care of as we enter into pregnancy, before pregnancy even. So thank you again, and hopefully this was helpful for our families there.
Yeah, I just one other thought that if you can try to very quickly touch on is IVF. I know many parents are now going through IVF. If you can maybe give us one insight for about a minute.
Yeah, absolutely. IVF, a very powerful technology that really helps in a lot of ways. One, for families and who are having trouble to obtain a pregnancy, we often use fertility treatment before IVF. Medicines to help increase the chance for pregnancy. But when you get to IVF, you're at a point where you've taken a lot of the variables that interfere with getting pregnant out of the picture. And one of the reasons why people use IVF is if they have some genetic problem in their, both the mother, the father, both carry a gene which is abnormal. IVF has the ability to actually test the embryos before implantation. So ahead of time that this is a pregnancy that doesn't carry the gene that may be there in the family. And this can be helpful to help avoid a genetic problem that is known in the family. So IVF is very, very powerful, but used in the right circumstances.
Right. So, but I know a lot of the literature states that you can go ahead and use that to avoid some chromosomal abnormalities, but there are associations with some sort of developmental issues as the child grows older. I also just want to touch on that, because I don't want parents to think that, hey, IVF is not something that they can just go ahead and do just to make sure that their child is not going to have any issues.
Right. Again, when we talk about developmental issues, we really have to be sure to bring up this point that not all developmental issues are genetic, and although IVF can help us test for genetic problems prior to the pregnancy and help to avoid genetic problems, you can't make sure that you won't have, it's not a way to have a foolproof situation where you'll never have a developmental problem. That really is a separate story completely.
All right. So, I mean, I think in this day and age of genetic engineering for everything, trying to find the best fruit, trying to find the best vegetable or plant, here we are trying to find the best that we can for our baby. But thank you so much, Miguel, for joining us and giving us a little bit of an insight into the world of prenatal care. That I think our listeners were grateful to have you on board on this. So once again, having a kid is a natural thing. It's the way the society goes on. It's how the world goes on. Our task is to make sure that we stay informed throughout the pregnancy process and deal with what comes out of it. Hopefully they'll be all good. And I think the majority of the cases, as you pointed out, there are no issues, but then there are other things that may be stumbling blocks for the family as they go on, and that's where my role would come in as a pediatrician, and our role if we get to that, but hopefully we don't have to. So thank you so much, Miguel, for bringing us on, and we'll be wrapping up at this point.
Thank you.
Absolutely. Thank you.
Stay tuned for next week, next Sunday.